also treatment with plastics like that. So apart from that, electrical hazards can also seriously affect the workers and the patients in the ward. The severity of the condition depends mainly on the electrical factors, and also they have the accidents that can occur and the risk of sustaining at least second-degree burns if we will properly maintain when in the contact with the electric current. So when the current passes through the heart or brain, the risk increase can lead to the cardiac arrhythmia and respiratory arrest, as well as finally leads to brain death. So in most of the cases, the victims needs to undergo limb amputation and live with a disability. So hospital management must take the responsibility to ensure the working conditions or environment that must be safe for the employers and clients. And proportionally and especially we can say that the employers and clients must adhere particularly to the hospital's occupational safety health policy. So like that means they follow the safety procedures and not attempting any high risk attitude. So these are the most important factors one has to understand. So especially the health hazard in the healthcare systems or the healthcare sectors, the healthcare professionals are come across the electrical hazards. So it is a significant threat in the hospital that requires sustainable assessment, and also the improvement is highly required. So the workplace assessment and also the medical surveillance systems, they are often overlooked, and also employees fail to comply with the necessary measures that have been instructed at the workplace. So this is very pathetic situation. So one has to understand that this is the most important as well as the crucial hazard for the healthcare sectors. And also the workplace assessment and the medical surveillance systems are more important, and also the employees fail to comply with the necessary measures that have been instructed at the workplace. So this is attributed, how they have been attributed to lack of knowledge regarding occupational safety and health, and also lack of awareness regarding its importance. So the consequences of the neglecting these assessments, that may definitely result in healthcare deterioration, and also we can say that low work quality, and also they may also cause the disability and impairment. So hospitals should adopt workplace assessments and also to improve the overall health of all the workers and also along with the patients, and that leads to increased productivity in terms of quality in health services. Therefore, the recommendations which are so far we have discussed are practical, feasible, and also on the implementation of these recommendations will hopefully result in a safer and healthier working environment. Dear learner, I would like to conclude this the electrical hazard is most significant threat in the hospital setup, and also the medical surveillance systems and workplace assessment is most important for the hospital management system. If we will follow the safety guidelines, definitely we can minimize the hazards as well as the damage to the health system, as well as the health professionals, as well as the hospital property system. Thank you. Hello viewers, welcome to the Postgraduate Diploma in Environmental and Occupational Health. I am Professor Rupani, Program Coordinator of the Postgraduate Diploma in Environmental and Occupational Health. Today we are going to discuss about the codes MEVE 002, that is a healthcare sector. So far we have studied about the lots of hazards that are come across by the healthcare professionals. So as a part of that one, today we are going to discuss about the physical hazards which are come across by which are faced by the healthcare professionals, especially in the healthcare sector, that is our hospitals or the nursing homes, and then laboratories, as well as the testing units. So today we are going to discuss about one of the important and major physical hazards which are faced by the healthcare workers in the hospital sector, that is the radiation hazards. So radiation hazard, we have considered the physical hazard. So today we are going to discuss about what is exactly the radiation. So the ionizing radiation from X-ray machines. So the ionization comes from the X-ray machines, and also fluoroscopes, and also computed tomographies which are used for the diagnostic as well as the therapeutic procedures, and image guided procedures, and cardiac that is a catheterization, and angiograms, and pain management, and also other and some of the other examples are highly hazardous in nature. So therefore it is a non-powerful enough to cause the ionization, that is the removal of electrons as the scientific terminology is concerned of the molecules. So the ionizing radiation is routinely used in the medicine or the medical field. The occupational health and safety of the hospitals, they provide the information. That means normally they will have the e-tools. So they will provide the information about the protecting the hospital workers, that is the healthcare workers, from the radiation exposures. They have the authority over the non-NRC which are regulated medical uses. So they do not involve the use of radioactive material directly. That is those involving radiation that does not come from the NRC regulated radiation sources, like diagnostic or the imaging techniques, that is like examples like radiography and computed tomography, CT, as well as the fluoroscopy. They used to normally to locate fractures and growths and tumors that determine the extent of an injury or disease and determine the necessity for other medical procedures. So these are the used. And the second point is the interventional techniques, that is for example fluoroscopically guided interventional procedures as well as the angiography, which are used to guide the treatments. And radiotherapy is also there, that is used for treatment of disease like cancer. Radiotherapy is also known as the radiation therapy that involves the use of the high energy ionization radiation to kill the cancer cells and also the shrink to, that is diminish the tumors especially. So non-NRC regulated radiotherapy is the use of X-rays as well as some of the accelerators. So many hospitals, they have the different technologies, and also they have the other regulations to use this one. As far as the medical imaging is concerned, many different technologies of which they have some examples I would like to give. A portable fluoroscopy machine that can be used to guide the cardiology, and they used to be the guide to the neurology and also other procedures. If you will look into the radiography, it is typically conducted in a radiology department through either a central department or satellite facilities, but they may be performed in certain doctors or officers, or especially the orthopedic department or orthopedic doctors. The radiographic equipment, especially they will fixed, and mobile radiographic systems are also there. That means there are varieties of radiography systems. So most medical facilities, they will use the digital radiographic equipment that produces digital images instead of X-ray films. And also this technology typically reduces the radiation dose workers and patients receive. So this is also one of the most major technological advancement, we can say that. For examples I would like to give, the next one is the computed tomography, CT, normally we can call it as CT. So they will call it as a CAT scan. So that involves using one or more X-ray beams to acquire images of one or more body parts from different angles around the patient. So because they generally involve many scans, that means only not in the one particular direction, they want to have the 3D, that means all areas and then all angles, we can say that. So because they generally involve many scans, CT procedures, and also associated with higher radiation doses for the patient and also high radiation hazards for the workers when compared to the general X-ray equipment. So the patient dose from a CT scan depends upon the part of the body examined and also the protocol of the CT. And then if we will see the fluoroscopy, so it is a continuous real-time X-ray image. So it is just like an X-ray movie that can be used to monitor the movement of the body parts as well as the objects or the contrast agents throughout the body. So it can be performed with the fixed or portable fluoroscopy systems, some fluoroscopically guided interventional procedures that have the potential for high radiation doses, like most interventional radiology, interventional cardiology and interventional neuroradiology procedures as well as the endovascular surgery. So when fluoroscopy requires higher patient doses for long period of time, it may result in increased risk of the deterministic effects like cutaneous, that is a skin radiation injury, like that. So employers should ensure that fluoroscopy workers receive appropriate training and also the information about the radiation hazards and also the probability of deterministic as well as the stochastic health effects. So the FDA also provides information about the fluoroscopy devices and their uses. So proper training is highly required for the technicians, those who are using the fluoroscopy. And the next one is the cardiac angiography. That means all these emit the radiations. They use a specialized form of the radiography, that is for the angiograms, for heart catheterizations, and that may include the angioplasty, that is a procedure. Normally it is used to open clogged arteries or the blocked arteries, and stent placements, and is often a fluoroscopically guided interventional procedure. So it involves the radiography of blood vessels after injecting a special type of dye to increase the X-ray images. So cardiac angiography, that will both a radiation dose from the fluoroscopy as well as the radiography. And another equipment, normally this radiation is come across, radiation is emitted, is the dental imaging. They use the special dental X-ray machines. Then definitely they will produce either digital or film images, and is typically performed by the dental doctors or the dentists or dental or the officers. So there is a new technology also came, that is mainly that is the cone beam computed tomography CBCT scanner. So it is used for the more complex oral and also the maxillofacial, that is a JAS, as well as the face imaging. So the employees should ensure that protective measures like safety positioning, the dental X-ray equipment, operator relative to the X-ray equipment, it is more important to keep radiation doses for the dental workers and also the to minimize the risks. So how to control this radiation hazard, especially in the healthcare sectors? So we will see that the range of non-radiological safety and health hazards for workers in the occupational settings with ionizing radiation hazards. For example, these non-radiological safety and health hazards are electrical hazards associated with the electrical equipment, which we have already discussed in the previous class. So, and then also laser hazards, if lasers are incorporated into this one. If we will look into the radiation prediction programs, so developing and implementing a radiation protection program is the best practice for the protecting healthcare workers or the healthcare professionals from ionizing radiation. So a radiation protection program is, especially if we will think that there is a protocol, that means usually managed by the qualified experts. Who are the qualified experts? That is a health physicist, are the healthcare professionals, are the healthcare technicians, especially those who have got the training and studied about this type of radiations. These people are collectively called them as radiation safety officers, RSO. So and also the another best practice, if we will look into that, is the designating a radiation safety committee. So that means the one RSO, that is a radiation safety officer, should be there as one of the member in that committee, and also a management representative